My name's David Smerkous. I'm a PhD student at Oregon State. My focus has been artificial intelligence, but more specifically on deep machine vision and uncertainty estimation. And I also work with Dr. Najafian in his lab at the University of Washington, where we do medical imaging, and I try to help them automate that process. There's been major concern with AI and the impact in healthcare. For example, everyone's worried, are technicians going to lose their jobs when it comes to imaging or processing samples? And I believe that's not going to be the case. I also share sort of a pessimistic view of AI, that it can be quite dangerous, but there's a lot of good use cases in the medical field, especially there's a lot of laborious tasks like in medical imaging where you have to do counting of lysosomes, counting of the GL3 or the foot process width. These are laborious tasks that take hours for people and technicians to complete. It's made these tests widely inaccessible, but AI can help us streamline that process and reduce it down to minutes, and so technicians can actually be focusing on processing samples rather than counting and doing repetitive tasks. Unfortunately, AI still requires a lot of human input at this point. There are self-supervised models and models out there that can be used to help us diagnose more broadly and generally. But what's nice that we do have right now is clinical data is going to be paramount to training these AIs to help us diagnose rare diseases. It's not going to be able to find novel diseases in its current state. I imagine maybe there's a future where that is possible, where we can use it, but AI, we can train it to take all of our imaging or our staining or other reports, aggregate it together, and try to help predict these rare diseases earlier than what people normally could, because it can put together a ton of details that would take normally days for any doctor to do. So in terms of diagnosing rare diseases, I think it'll help streamline this process, or at least give a subset of possible conditions this could fall under to explore further. The goal of the talk was just to show the importance of AI in specifically medical imaging. There's a lot of other applications, but that's where I specialize in. And we wanted to show what does the pipeline look like? Because a lot of people are like, okay, AI, but how do you give it the information? How does it learn it? Well, I was trying to show the entire pipeline from start to finish of how we train the data. Once you train it, how do you use the data? How do you process it to actually get the statistics or diagnosis that you want and quantify the disease progression? And I think that's where AI really plays a crucial role is in the quantification. It doesn't have to do the full diagnosis, but it can give you a more detailed report than a technician on their own can. So I think we have had a pretty narrow view of how AI has been applied, and because the specific use cases have been sort of, for us, like imaging or signal processing, or now a lot of it has been already quantified data. The next step is to be able to use sort of natural language, and people sort of underestimate how powerful clinical reports or longitudinal data is to diagnosing patients. And I think we'll actually start to see these language models be used in the future to help us diagnose these patients, and not replace any doctors anytime soon, but give them actually suggestions, because a lot of people who are specialists tend to focus too much on their specialty, and maybe these AIs can help them broaden their view and see, could you consider this other rare genetic disorder when you've been really just focusing on Fabry or Pompe, and maybe it's something else.